Cureka.com, and we are live with our weekly live session with a specialist doctor to take care of your concerns. Today, we are going to talk about management of herniated discs with Dr. Vibu Krishnan, who is an orthopedic and spine surgeon. Dr. Vibu is going to help us understand how we can take care of the herniated disc, what sort of problems could arise because of herniated disc, and how we can take care of our lifestyle in day-to-day life to take care of our spine and overall orthopedic health as well. Now, Cureka is, you all are aware, I mean, we are getting a lot of love from you each and every week. You send us a lot of messages, keep on sending us your queries, and also we get a lot of love and orders on Cureka.com as well as in our store in Indranagar, Bangalore. So guys, as I always say, we have got a free of cost WhatsApp platform on Cureka.com, which you can use to connect with the doctors and try to understand what is the recommendations for you based on your concern. Now, we also have a very premium brand which has been onboarded on Cureka. Its name is Health ETC. Health ETC is a premium brand of products which is good for your healthy living. There are multiple, very fun gummies which you can take, while on the move. They are very, taste like candy, but they are completely plant-based, natural, without any toxic ingredients whatsoever. And these gummies can be taken anywhere without, like we have some medicines and we take it with water, very boring stuff. Health ETC is not like that. So let me tell you. So Health ETC is very tasty, tastes like candy, and it can take care of your immunity, your woman's health. It can take care of your, gummy on the go, which is the multivitamin, sleep issues, and variety of problems. Dr. Vibu is going to join us now. Hi, good morning, Dr. Vibu. How are you?
Morning, nice to meet you. Thanks for
Same here, doctor. And glad to have you on board today, and our guests are delighted to welcome you on our weekly show where we onboard and we welcome a very specialist doctor to take care of our concerns. Now, today's topic for the day, doctor, is management of herniated disc. First of all, I would like to understand what is a herniated disc, doctor.
Like we all know, disc is basically, it's like cushion. It's like I usually describe it as a balloon. It's like a balloon filled with water. It's between two bones of the spine. So the bones of the spine are called the vertebrae. So there are 33 vertebrae. So almost there is a disc between each vertebral body or each bone. So it basically acts as a cushion between the two hard surfaces of the bone. So by what we call as a herniated disc is there is a the balloon which is filled with water as time goes on, the water inside the balloon actually gets a little hardened, so it's like a jelly. When in young adults, it's more like a jelly within a bag. So when there is a rupture of the outer membrane, which is called the annulus or the outer cover of the balloon, this jelly sort of gradually slips out of the cover, and that's what we call as the herniated disc. Usually there are, most of us do encounter such disc herniations during different stages of our life. Sometimes they just heal off over time. They may present as pain, back pain for a little bit, but they heal off. Sometimes they do cause symptoms, and that's when the herniated disc needs to be taken care of.
Right. Thank you, doctor, for these details. Now, doctor, a lot of people ask us this question: what is the main cause of a herniated disc? How does it happen?
Yeah. So that's a common question asked. Basically, as most of the things in medicine, the cause is multifactorial, and there are many things that could be contributing to it. There is definitely a genetic element. the discs, as it said, in the kids, it's basically it's really elastic. So it's, as I said, it's a balloon filled with water. But as we age on, the water or the content inside, it starts getting harder and harder, and in adults, in older adults, it gets solidified. So it follows a certain pattern as we age. But as we know, just like most of the changes which happen with aging, some people have a tendency to have gray hairs even in younger age. Some people may lose hair even at a younger age. So like that, some people have genetically a greater predisposition for these aging related changes in the discs to happen even at a younger stage. So we what we call as a young disc is which has a lot of water content inside. So but as we age on, the water content inside the disc gradually goes down. So basically, these disc changes are natural things which happen with aging. So aging is the most important predisposing factor. The incidence of disc herniation in the 60-year-olds is much more than in 20-year-olds. So that's one of the things. But obviously, with genetic elements, some people get prone for these disc herniations even in their 30s and 40s. So apart from the genetic predisposition, there are a lot of environmental factors too. Some even though we know that it's not a cause, we know that disc herniation actually happens even in very healthy athletes. It's known to happen in athletes as well as people who follow a sedentary way of life. But back health does contribute. Poor back health does contribute to disc herniation. That's one of the factors which we do it. By back health, I mean people heavy activities by which the disc is loaded significantly. People who are in jobs where they lift weights, uh, uh, and people who are not used to regular back exercises. So that is a contributing factor. Um, so, uh, uh, Body weight sometimes is also known to contribute to disc herniation. And as we say, smoking, it's an important factor. This is another important environmental factor which can contribute to disc herniation. So there is not usually there is not a single causative factor. There are multiple, as I said, genetic, environmental, and
Lifestyle related?
there can be some trauma or injury to the disc which can trigger the actual event which leads on to the disc herniation.
Dr. Vibu, also lifestyle related problems could create a herniated disc.
By lifestyle, definitely um, it happens with repetitive physical activities too. In heavy workers, there is we know that the disc herniations can be more seen, as well as really very sedentary lifestyle when the muscles of the back are weak. Even people obesity can contribute to disc herniations. Although we know that by numbers it may not exactly be a causative factor. Smoking definitely contributes to disc herniation. Smoking actually weakens the disc material, the matrix, and therefore it can lead on to disc herniations. Apart from that, people with the metabolic disorder, as we call, which is usually a combination of obesity, diabetes,
Disc.
and hypertension. So sometimes these do contribute to the increased prevalence of disc herniations.
Understood, doctor. So, doctor, what are some of the common symptoms of herniated disc?
The as I said initially, a big part of disc herniations may be asymptomatic, because when we get an MRI scan in 100 adults, 30% of them may have some findings on MRI scan. They may have disc bulges, and they may not be symptomatic. So, majority of the disc herniations are asymptomatic. In terms of the symptom, the most common symptom is pain in the back, which is called the axial pain. So that is possibly because when there is a break in the outer cover of the disc or the annulus, that leads on to the acute disc pain that we know, discogenic pain. But what we are more what is more important to us, as treating physicians, is whether the pain, it radiates down the leg, which is typically what we call as the sciatica, or the radiating kind of pain, or the shooting pain, which moves from the back to the buttocks, to the back of the thigh, all the way to the foot. So that kind of pain is very typical of um, this
Okay.
herniation. Other than that, numbness can be sometimes in the lower limb. There can be weakness in the lower limb, and in very very severe herniated discs, we call what we call as cauda equina syndrome,
Yeah. So,
whereby the urine. Sorry.
hello.
Yeah.
Yeah. So, doctor, so does sharp pain in a leg mean that person is having herniated disc?
Um, it definitely, as I said, the characteristic pain is the pain in the back, which radiates down the leg, in the back of the buttock, in the buttock, the back of the thigh, back of the leg, and to the all the way to the foot. That is the typical pain that indicates this herniation. A lot of times it needs to be evaluated by a physician when we have the radiating kind of pain, because pain in the hip joint can also lead to pain radiating all the way to the front of the thigh and the knee, and pain in the knee also can lead to pain over the back of the thigh. So a radiating pain is not always indicative of a disc. Other causes can lead to such presentation, but in a good number of patients this may be the case.
Right, right, doctor. So, is there any orthopedic support devices like belts to manage herniated disc?
Definitely, belts do help for the neck disc herniations. The collars can be helpful. The belt for the lower back. But when we advise belt, it is typically very helpful in the initial period. And when you have a very severe disc herniation, it keeps the it's like it increases the pain pressure in the abdomen, and therefore keeps the back straight, and that really relieves the pain in such situations. The only thing that we advise with the belt is the patients sort of tend to get dependent on it for a very long time. So the usual advice is that to use the belt in the initial 2 to 3 weeks, and after that gradually wean off them if it is if even if the pain persists, because using them for a long time can actually weaken the back muscles. So it should be used under a guidance of a physician.
Okay. Now, doctor, how to avoid herniated disc in people who are having hip or buttock pain in long because of long sitting workers like drivers and computer professionals?
Yeah. As we just started discussing, it is known to be prevalent among people who, I mean, because of our lifestyle, we sit for long hours. The sedentary lifestyle has its own disadvantages with regard to the back. So the most crucial thing, in terms of prevention, avoiding disc herniation, would be to take care of our back postures. So the ergonomics is I mean, it's a field that's coming, that's really crucial. So in terms of our postures, when we need to sit for long hours, especially the software professionals, the chair that we use with good back support, good elbow support, the support extending all the way to the neck and the back of the head. So such chairs can be very helpful. Keeping the system, especially if you're working on system for long hours, keeping them on in line with the with our eyes, so that we don't need to bend too much forward or look up too much. So that can be quite helpful. And it's usually, even if you need to sit for long hours, like 3-4 hours, it's usually advisable to take a break at the end of 45 minutes, go for a short stroll, and then come back and continue. So that can give the muscles a little bit of break. That can be helpful. And apart from that, regular exercising for the back, that can be the most crucial. Keeping our back muscles fit and strong, that can be the most crucial in terms of avoiding back dislocations.
Right, right. So similar question is asked by Doctor. Arun, and Arun is asking, I am an IT professional and sitting for long hours lead to back pain. Will it affect my spinal health? So I believe you answered most of it, but would you like to say something to him?
I know it's basically the commonest thing that we sort of encounter in our current day. Definitely take before being proactive and doing the back exercises.
Yeah.
Before you start having back issues would be very crucial. And definitely the other supports that we discussed, right?
Hmm. Understood, doctor. Thank you. So I'm sure, Arun, you would have got your answer. If you've got any more questions for us or for Dr. Vibu, please do send in the comment section below, and we will take them up during our live session or after it. We'll come back to you. Now, doctor, listeners are asking, can hot or cold massager helps to reduce pain in herniated disc?
Um, Actually, both hot fermentation and cold fermentation do help in reducing pain. And the other thing that they help with is what we call as spasm or the tightness of the muscles around. But usually, since this is a disc herniation involves a lot of muscle spasm, the hot fermentation or heat actually helps better in terms of the spasm relief. So um, they are very helpful in the initial period, especially when the pain is very severe. I usually advise in the initial 2 to 3 weeks to hot fermentation in patients who present with disc herniation. I usually say typically do the exercise in the morning, afternoon, and the night time thrice a day, and then after the exercise is done, hot fermentation for the next 5 to 10 minutes. That's all again thrice a day, and then dry it off completely and apply local ointment. So this way, you are on a regular, physical physiotherapy protocol, as well as you do have a good relief of your spasm, which helps in the initial days, in the initial 2 to 3 weeks after disc herniations.
Right. Thank you, doctor. I think that's quite helpful for a lot of people. Now, does herniated disc cause low back problem, doctor?
Um, Low back pain.
Yeah,
Yeah,
correct.
definitely. So it's a process of degenerative disc disease, as we call, and herniated disc herniation is usually the initial stage of the disc degenerative disc, which progresses on to back pain in the long run. So
Yeah.
definitely it contributes to this back pain.
And how can anyone try to avoid this pain or probably reduce the pain by doing something?
As I said, it's usually a combination. The management is a combination of treatment. In the initial period, anti-inflammatory medications are very helpful. So commonly we use paracetamol, which is the safest anti-inflammatory medication. And apart from that, if the pain is more severe, we call what we call as non-steroidal anti-inflammatory medications, which can be again taken under physician guidance. And if the pain is even in more severe kind of pain, low dose steroids, those are the anti-inflammatory drugs which can be administered. These steroids can be administered as tablets, or they can be administered as injections, or they can also be given as targeted injections to the nerve, which has been pinched by the disc. So these are the medical therapies that we initially start. Apart from that, there are some medications which also release the pressure around the nerve root and around the disc. So they can also be started with the neurotonic agents. Apart from that, for the pain, as I said, it's a combination of physiotherapy as well as physical therapy. Physiotherapy is the exercises initial 2 to 3 days after the pain starts getting better. The back exercises can be started, and apart from that, physical therapy, by which we mean there are ways by which we can like shortwave diathermy or interferential therapy, by which we can those are ways by which the electrical energy is converted into thermal energy, and deep thermal energy gives good relief of pain. So those can be administered at local physiotherapy centers. And again, hot water fermentation and ointments can be very helpful at this point. And apart from this, the initial periods, as we discussed, the lumbar belt. So these can be helpful. Right.
Right. Right, right. I'm sure that's quite helpful for a lot of people, especially who are suffering because of herniated disc due to age or their profession. As you said, people sitting for long hours, they are susceptible for herniated disc. Now, doctor, how do we know, for example, if a back pain is due to degeneration of the disc, or is it kind of a muscle strain? How can we differentiate between the two?
Yeah. Back pain is one of the most common disadvantages that we humans have because of our erect posture. So almost every adult, beyond the age of 25, suffers from back pain. At least twice or thrice in their lifetime. Significant, episodes of back pain. And 99% of these back pains actually do improve without any intervention. The body has a capacity to heal. So whether the back pain that comes is due to the disc or due to local ligament or other soft tissue injury, we the what we usually say is the patient who comes to us on day one, you could start on some anti-inflammatory medications, a little bit of rest for the initial 2 to 3 days. The pain due to other causes usually subside. They may not be completely, they may not come down to zero, but the patients usually have at least 40-50% improvement in the pain or pain severity if it is due to other causes. So if the patient actually gets better in the first 3 days, 4 days, then he may not require any further investigation. He may need to be on a little bit of activity restriction, analgesics, and usually it settles down. But if the pain continues to persist or it gets worse and even beyond a week's time, then it needs investigation, whether it's due to disc or any other reason. So um,
Right. Right.
usually the
Right. Sure. Thank you.
thank
Thank you for clarifying that, doctor.
you.
Doctor, now can a person climb stairs with a herniated disc? Is it recommended?
Usually the disc is in the front part of the spine, and therefore any movement which involves bending actually worsens the pain related to the disc. So when we actually climb up and down stairs, there is a good amount of bending of the spine which is involved, so it can be painful. But there is the usual recommendation is that the initial, even the period of bed rest that we say, is for the initial 2 to 3 days, and after that we want the patient to keep moving. It's not
Keep
a
moving.
complete bed rest may not be the solution to even a disc herniation. We usually say activity modification, by which we mean to avoid activities which severely worsen the pain, because by doing that we know that we are actually irritating the disc which has herniated, and therefore we are
Yeah.
increasing the inflammation. By which we mean bending forwards. That's usually what is going to worsen most. If the patient is comfortable walking up and down stairs and it's not bothering him a lot, he can continue to do so. He won't worsen. But if it really, for a person, even that much of bending is really hurting, then we advise him to not to go ahead, going up and down stairs on a regular basis, and worsen his symptoms. So based on how the
Understood.
patient is comfortable, as tolerated, he can go ahead.
Yeah. Yeah. Understood, doctor. So, doctor, what are the common symptoms if a person has slipped the disc in the neck vein?
Again, like there is a pain in the neck, which is the axial component of the pain, and there is a pain which
Yeah.
radiates down the arm. So a lot of times the pain related to the shoulder, as we said in the back, hip and knee pain also can cause similar radiation, but a shoulder-related pain never radiates below the elbow. So any pain which radiates below the elbow is possibly arising from the neck. And again, there can be some weakness in more severe stages. There can be numbness, and in some very severe situations, there can be loss of balance and hand dexterity functions. So neck pain and radiating pain are usually the most common.
Understood. Understood, doctor. So, doctor, does numbness mean that a person is having a disc disorder?
Um, Not exactly. As I said, now pain or radiating pain is the most common symptom for a disc herniation. So usually the numbness in disc herniation is accompanied by either a neck pain or a radiating pain, or a back pain and a radiating pain. Numbness alone can be it can be due to a burnt out disc. A person who had a disc herniation, and then they initially had a lot of pain, but that subsided. But the numbness may sort of take a longer time to recover. So numbness and disc herniation can present that way, but there are a lot of times, even in diabetics, you have what we call as neuropathy, which can be, a cause for numbness alone without any back pain, whereby the nerves in the periphery are get a little weak with due to diabetes or due to aging. So we just need to evaluate a patient who has numbness alone for other causes than discrimination.
Right. So, doctor, there is a question coming in from a listener. Her name is Prema. Prema is asking, my husband complains of neck pain often, and he's a computer professional. How can he manage that without bothering his spine? What symptoms should be noticed to be aware that it's affecting the spine?
Um, Thanks for the question. As we discussed, you know the neck pain can be due to the fatigue of the muscles because of long sitting hours and the postures, or it can be because of some stretching or irritation to the ligaments or the other soft tissues, or it can be due to anything more with the spine or the disc. So the best way is to first take good care of the postures during work. We discussed with about the chairs. We discussed about the position of the system, the laptop, and neck exercises at this point can be extremely helpful. To start, we need to we can be proactive and start them even before we start having the actual more severe symptoms. And definitely sitting for long hours, I would recommend some breaks at the end of 30-45 minutes, and make sure that the neck gets a little relaxed. The muscles, when the muscles get tensed when you're sitting for long hours, so once the muscles get relaxed, it can get better. So with these modalities, if the pain gets better, then I would advise to continue with the physiotherapy. But if it persists beyond that, then it is better to get a physician advice.
Understood. Understood. So I believe, Prema, you would have got the answer to your question. If you have any other questions, please do let us know. Moving on, doctor. Falcon Sachin is asking us a question. If we take calcium tablet, can we protect spine health?
No. That's again a common question that's asked. So usually calcium can. I do not recommend calcium tablets alone prophylactically. It can be taken in other situations when the patient has a specific post-operative or such situations. But most of the time, when we take just calcium alone in a young patient, most of it actually gets excreted. So it really doesn't get absorbed a lot. But as for disc herniation, it may not really be that helpful, being on regular calcium medications. But as we talk about back health or spine health, the common things that we see regularly are, one is osteomalacia, or there is a deficiency of vitamin D, which is quite prevalent in our present situation. Or patients, older patients who go in for osteopenia or osteoporosis. So those also coexist in patients with degenerative disc disease. In such situations, we need to, apart from calcium, the patients can be started on vitamin D, regular supplementations. With vitamin D, the calcium actually gets absorbed quite well, and that the combination of the two is required. And if it is osteoporosis, then per se that needs to be treated in a totally different way. But a healthy patient, young patient, 30 or 40-year-old, with no osteomalacia, no osteoporosis, only having disc issues, disc degeneration, may not really benefit from regular doses of calcium.
Right, right. Sure. So, with this, thank you so much, Doctor. I think this is very insightful, and thank you so much for joining us today and helping our listeners to understand what is a herniated disc, how you can take care of it, what could be the symptoms. So guys, if you have any questions around herniated disc, please do send us in the comment section below and we'll come back to you. I'm sure this session is very helpful for you. Thank you so much, doctor, and we wish you a very, very happy weekend. Would love to join, collaborate with you again to help us with, general people to understand about different topics around orthopedic and spine health. Thank you, doctor.
Thank you very much. It was a pleasure meeting you.
Thank you so much, doctor. Yeah. So guys, now at Cureka, we've got, thousands of products which are there curated by doctors, specialist doctors like Dr. Vibu, who are helping us to curate products which are, excellent for your healthy living. So do check us our WhatsApp platform where you can get recommendations for the product which are best suited for you, or if you are aware of what product is suited for you based on your concern, whether it's skin care, hair care, nutrition, orthopedic support, elderly care, pain management, maternity care, baby care. We have got all the top-notch brands at very, very affordable prices. A lot of offers running right now. Do check out the Cureka website and do give us a chance to serve you. Also, we've got Cureka store. So the guys who are there in Indiranagar, Bangalore, please check out our Cureka store. It is in the 12th main, just behind ICICI Bank, and you can visit our store and let us know how do you feel. As I told you, Health ETC is a brand, premium brand, which is onboarded on Cureka. Do give it a try. It's a wonderful product recommended by doctors, curated by doctors. It's actually prepared using plant-based ingredients only, non-toxic completely. A lot of people have recommended these products. You would find them across online. You can check it out. People, especially who are suffering from sleep disorders, anxiety, stress issues, they'll find a lot of good products. They've got a special, go to sleep giving, which is fabulous. Next, guys who are having some ladies who are having menopausal, postmenopausal health issues, they can check out Women's Health Gummy. There is also a hair health gummy which is having a lot of good ingredients to take care of your hair health. So guys, do check them out. Health ETC is there to help you out, and let us know what topic do you want me to cover next week. I look forward to your questions and comments. Take care, have a good day, and wish you a very, very happy weekend.